On this edition of Veterans Health Watch, we'll clarify the eligibility criteria for VA healthcare benefits and explain how veterans from all eras can apply for these services.
We'll also learn about VA primary health care for enrolled veterans and learn how you can help prevent the flu this year.
Welcome to Veterans Health Watch, a program sponsored by the Veterans Affairs Maryland healthcare system that provides the latest health and benefits information for Maryland's veterans, their family members, and the local community. I'm your host, David Edwards.
And I'm Chris Buser. Thanks for joining us.
On this edition of Veterans Health Watch, we're going to be talking about the eligibility criteria for veterans in the VA healthcare system, and joining us is Ralph Norman, the Administrative Officer at the Perry Point VA Medical Center. Ralph, thank you for joining us today.
Thank you very much for having me.
Ralph, why don't you get us started by defining the term veteran as it applies to VA healthcare services?
A veteran is someone who served in one of the military branches, the Army, Navy, Air Force, Marines, Coast Guard, and who was released or discharged with a other than dishonorable discharge.
And Ralph, what are the eligibility requirements for a veteran to receive VA healthcare?
A veteran coming in applying for VA medical care has need to serve on active duty other than for training purposes only, and should have an honorable discharge under honorable conditions.
So, Ralph, now we have veterans interviewing audience today who are watching the program. They're hearing what a veteran is as applies to VA health care and what the basic eligibility criteria is. Now, can you describe the actual enrollment process and what do they need to do now to come in and enroll for VA health care?
Well, there are several ways a veteran can enroll. They can do that in person by applying at any one of the VA facilities through the VA Maryland healthcare system. If they do come in person, it would expedite the enrollment process for them if they brought in a copy of their military discharge, DD-214, or some verifying document of their military service. They would be asked to complete VA Form 1010-EZ, which is an application for health benefits, and upon completion of that, they would have completed the enrollment process at the facility. They can also go online, and they can also enroll electronically. They would complete the same VA Form 1010-EZ. They would do it online and submit it electronically at the VA facility of their choice. Or if they want to apply by mail, they could get a copy of the VA Form 1010 at any one of the VA facilities. Or if they have access to a computer and a printer, they could print out the form online, and then they could fill it out at their leisure in the privacy of their own home, and then they could mail it to the VA Enrollment Center at Baltimore, Maryland.
So it sounds like a fairly simple, easy process to enroll for VA healthcare.
Very easy.
Very good.
And it sounds like they have lots of options, depending on what best suits them. Once they've actually submitted the application, how will a veteran know whether they've been enrolled and are found eligible for healthcare benefits?
Well, once the veteran has enrolled at one of the facilities, that information that they provided will be submitted electronically to the Health Eligibility Center, which is located in Georgia. And then once they process the application, they prioritize the veteran by a priority group, and the veteran will receive a letter in the mail from them. It usually takes 24 to 48 hours for that process to take place. And once the veteran receives the letter advising them that they were accepted for enrollment, or if for some reason they were not accepted for enrollment, that would be explained in the letter, and they would also be given a priority group 1 through 8 at that time. Once they do that, then they have their enrollment process already completed. Then they can contact our VA call center and request a primary care appointment for their medical care.
Ralph, I understand the VA offers dental services, long-term care, eyeglasses, hearing aids, but I understand that there are some eligibility restrictions on receiving some of those specialty services. Can you tell us a little bit more about that?
Certainly. Dental benefits by statute are different than the inpatient, outpatient eligibility requirements. Veterans that are 100% service connected for a disability, or veterans with a compensable dental condition, or veterans who are unemployable due to a service-connected condition, or former prisoners of war are eligible for VA dental benefits.
And Ralph, what about the eligibility criteria for nursing home care, eyeglasses, and hearing aids as well?
Nursing home care for enrolled veterans, 70% service-connected for disability. There are veterans who service-connected need nursing home care for their service-connected condition, or those veterans who are unemployable related to a service-connected condition are entitled to nursing home care. Other veterans as well may be under special circumstances entitled to nursing home care, but they may be subjected to a copay requirement and will require a financial assessment. Eyeglasses and hearing aids can be provided to any veteran with a 10% compensable disability, former prisoners of war, and veterans who have special circumstances, medical needs, inpatients. They can also be evaluated for hearing aids or glasses and may also receive those items as well.
I'm sure if veterans have questions, the best way to find out is to ask one of your VA medical centers or the eligibility office for more information.
Correct.
And Ralph, speaking of questions, we're actually going to go to the VA Maryland Healthcare System's Baltimore campus, where Dr. Lois Freeman has several veterans who are waiting by with questions.
We're here at the Baltimore VA. We are joined by several of our veterans today. Thank you for joining us with questions about VA Maryland healthcare. This is David Savinsky, U.S. Air Force veteran. Dave, what is your question regarding VA healthcare today?
I was out of the Air Force for several years before I decided to apply for VA healthcare. I'm sure there are other veterans that would like to know, is there any time limitation in applying for VA healthcare?
That's a very good question, and there's absolutely no time limit for applying for VA medical care. However, the VA does encourage everyone to apply as soon as possible after they're discharged from active duty, and also to let everyone know that the VA provides care not only for service-connected veterans, or you don't have to be a combat veteran. If you're a veteran with an honorable discharge, everyone should apply, and the VA encourages everyone to apply as soon as possible.
I believe Dr. Freeman has a veteran with another question about their health care benefits.
I'm here with U.S. Army veteran Bob Thompson. Bob, what is your question concerning VA healthcare today?
I know the VA healthcare enrollment application contains a financial assessment. Why is this required? And what happens if a veteran loses his or her job or experiences a financial hardship?
Veterans, some veterans, not all veterans, but some veterans are required to do a financial assessment, a means test. What that does is determine, based upon the information they provide, if they will be subjected to a copay or not. There are outpatient copays and inpatient copays and medication copays, and that means test will help determine if they should be required to make a payment for that or not. Veterans whose income may change after they have done a financial assessment for the prior year, they do find themselves in situations where their income will change. And when that happens, to assist them, the VA will let them apply for a hardship or a VA waiver. What that does they will be allowed to reevaluate, reassess their current conditions, employment, income status, and if they were subjected to a copay previously, they can be exempted from a copay, and that will be good for a year from that date. So the VA will accept hardships because everyone's situations can change from the year that they reported their income data.
I'd like to thank Mr. Savinsky and Mr. Thompson. Now back to the studio to David and Chris.
Thank you, Dr. Freeman. Ralph, if we have veterans interviewing the audience today who have questions about applying for VA health care, or if they have questions about applying for a hardship waiver, where can they go and who can they call?
Well, there's several ways they can do it. They can contact the Community Outreach Program at Perry Point. There's a toll-free number. Or they can contact the Enrollment Center. Or if they want to go in person and discuss with the Enrollment Center, the Eligibility Office, they can do that. And it behooves anyone whose circumstances may have changed to consider a hardship or a waiver request, or they can have their means test reevaluated if circumstances change from the previous year.
Ralph, thank you so much for joining us today. I'm hoping veterans watching today will call, go online, and enroll for VA health care or check on their eligibility. So thank you very much.
Thank you.
We're going to take a short break, but when we come back, we'll be learning about the managed care program throughout the VA Maryland healthcare system, so stay tuned.
Those veterans who don't enroll in care, many times if you ask them if they're a vet, they'll say no, but I did serve in the military.
Anyone that made that commitment to put your life on the line for others is a veteran.
The system is very accessible. For instance, enrollment. We have 3 ways to enroll.
You can enroll online, you can physically go into the VA and enroll, or you can telephone to enroll.
Doesn't cost anything to enroll. All it takes is a few minutes of your time and a copy of your DD-214. That's all you need.
I'm a veteran myself, and I tell the family, when you entrust the care of your loved one to me, you can go home safe and very at ease.
Best thing that you can do is just come in and apply.
Without a doubt, any veteran definitely owes it to themselves to enroll. You know, your health and well-being is priceless.
Did you know that Department of Veterans Affairs provides physical and mental health care for over 8 million veterans? Hi, I'm Natalie Dell. I may be an Olympic medal winner, but I know that real champions are those who have served this country, and VA knows that too. As a VA employee, I've seen the challenges our veterans face. I'm honored to be part of a team that supports veterans in achieving fuller, richer lives, and I invite you to join us in this rewarding experience. If you're a mental health provider, I urge you to visit vacareers.va.gov.
Welcome back to Veterans Health Watch. Joining us now is Dr. Martin Garcia-Bunuel, the Director of the Managed Care Clinical Center for the VA Maryland Healthcare System. Dr. Garcia, thank you for joining us today.
Thanks for having me.
In our first segment, we were talking about eligibility criteria for VA healthcare. Can you now tell us, after a veteran is enrolled and found eligible for VA healthcare, what healthcare services are they eligible to receive?
Well, we invite our veterans when they've enrolled and are eligible to make a primary care appointment. That's our entryway into the system, and that's how we do welcome our veterans in to provide them with the beginnings of a primary care relationship with their physician and primary care team.
Dr. Garcia, what does a veteran have to do to access their health care benefits?
Well, it's as simple as make an appointment. We have several sites around the state where we provide primary care services, and veterans can call and make an appointment at the site that's most convenient for themselves at a convenient time, and that gets the ball rolling.
Dr. Garcia, I know the VA is striving to become more patient-centric, and I heard that the VA recently initiated PAC teams, patient-aligned care teams. Can you tell us a little bit more about this new model?
Yeah, well, the model, in many ways, it's part of what we've always done, which is taking good care of our veterans and making sure they realize they're the most important people in the room and in the medical center at any given time. But more specifically, the patient-aligned care team is similar to what we hear about in the community called the patient-centered medical home. And that's so that the veteran and their family members or caregivers can come in and know they're going to see a group of people that they're familiar with, and they're going to see them consistently. So their primary care provider, who may be a physician or a nurse practitioner, nurse care coordinator, a health technician or a licensed practical nurse, as well as a clerical assistant. And that forms the core of the patient-aligned care team, and that allows the veteran to know there's a group of people that can answer questions and be available for a variety of different issues.
So Dr. Garcia, it sounds like the patient and their provider are working as a team to take care of their healthcare needs, but what if they need something like a specialty that's outside of their PACT team?
Well, in general, we have the patient start with their PACT team, and it could be potentially any team member who can help them identify what their needs may be. We have a pretty straightforward and simple referral process. We have access to a variety of specialty care services, mental health services, social work services, nutrition, and dietitians, a variety of services that are always available. And it's really just a matter of asking a member of your team how to access those services.
We're now going to go to the Baltimore VA Medical Center, where Dr. Lois Friedman has questions from several veterans about their health care.
Joining us now is one of our female veterans, Kenya Jones, U.S. Army veteran. Do you have a question for Dr. Garcia?
Dr. Garcia, I would like to know, does a woman veteran have to have a separate primary care provider and a women's health provider?
Oh, that's a great question. We actually have two different models of care. A female veteran can come in and get all their care from one provider and primary care team, the PACT model that I previously described, and we call that comprehensive women's care. We also do offer what we call gender-specific care. That typically happens when a female veteran may already be enrolled, have a very good relationship with their primary care provider, but also wants to get women's health services from a specialty care nurse practitioner. So both of those are options, and we provide the choice for our female veterans.
We have another question from a veteran at the Baltimore VA Medical Center.
We are now joined by U.S. Army veteran Dallas Renninger. Mr. Renninger, what is your question for Dr. Garcia?
Dr. Garcia, how will the new Affordable Care Act affect my VA health care?
Well, it won't affect it at all. And that is because you can continue to come to the Veterans Healthcare Administration for all your medical care services. And in addition, even as part of that new law, the Veterans Healthcare Administration is actually a legitimate and registered provider for full healthcare services in the United States.
Thank you to all of our veterans, and now back to the studio.
And thank you, Dr. Freeman. Dr. Garcia, I've been hearing a lot lately about how the VA is integrating technology into its managed care practice to help benefit veterans and allow them to stay at home and live a healthier lifestyle. Can you tell us a little bit more about that?
Yeah, there are actually several great things going on in the VA. Probably the nicest one I can mention that's related to the PACT teams is that veterans can enroll in something called My Healthy Vet, which is a great portal into information about their health and looking at health from not just the doctor's office perspective, but how to live a healthy life and prevent illness. And the second part of that is we have a program called Secure Messaging. And that's essentially a secure email system that specifically comes through the medical center and specific servers, so it's very private and confidential. And veterans can actually contact their healthcare team through that with simple questions, medication questions, whatever it may be. And that's a really nice part of the technology we have. In addition, we have some home telehealth offerings where patients can manage chronic disease through remote monitoring of blood pressure, blood sugars, and we actually have a weight loss program called Telemove, where veterans can actually also incorporate weight loss techniques into their day-to-day living and then get feedback from our trained specialists at the medical center.
Very good.
Dr. Garcia, I see how these infused technologies can help make it easier for a veteran to navigate their health care. But what about a veteran who wakes up one day and isn't feeling well and needs to actually talk to someone? What can that veteran do?
You know, that's an excellent question, because many times we can't predict those things in our lives, and we need to know what we can do quickly. Obviously, we have a full emergency medical service department at the Baltimore Medical Center. We also have an urgent care center at our Perry Point Medical Center. So for the veteran who has a real significant concern and needs to come in the hospital, they don't need to wait. They can come on in and we'll see them. We also have a telephone care program, and that's a phone line that's staffed by highly trained registered nurses who can really help guide a veteran through certain health questions that are coming up on a day-to-day basis, and maybe even give them some guidance as to what their next step is in their plan of care. The nice thing too is that those nurses are in contact with the veterans primary care team, so they can help coordinate that care and keep the veterans team aware of what's going on.
Dr. Garcia, if there's veterans watching today who want to learn more about the programs and services available through managed care in the VA Maryland healthcare system, where can they go or who can they call?
Well, we have some great resources on the computer, on the web, and veterans can then locate the closest available site for them to get their health care, as well as the phone number they can contact the medical center directly to get further information.
Great. Dr. Garcia, thank you so much for joining us today. I really think our viewing audience learned a lot about the primary care and managed care services available throughout the VA Maryland healthcare system, so I thank you for joining us.
Thanks for having me. It was great.
We're going to take a break, but when we come back, we'll be learning about how to prevent influenza this flu season, so stay tuned.
The VA Maryland healthcare system is the overall healthcare system for veterans in the state of Maryland.
We have 3 inpatient locations as well as 6 community-based outpatient clinics.
The treatment that I've received from the Maryland VA healthcare system, it's been top-notch, definitely cutting edge.
I think what makes the VA innovative is constantly exploring new ways to become more efficient and more effective. We were the first hospital in the world to make the transition from film-based radiology to filmless radiology.
We measure everything we do. We are always keeping track of our ability to deliver the standard of medical care to all our patients. We have the most committed, diverse, and caring group of professionals.
You know, a lot of us have served in the services. These guys and these ladies, I mean, they're everything to us. And there's nothing I would not do for them.
I don't know what it's like. I don't know what it's like to be in a war. I don't know what it's like. I don't know what it's like to be shot at. To be put in harm's way. Put my life on the line. I don't know what it's like. But I do know no one comes back the same. No matter how tough you are, how brave, how patriotic, anybody can get hurt. And not just physically hurt. If you're a service member or in a military family and you're feeling hopeless, you're not alone. Please call this number. It's confidential and free. Your family needs you. We need you. Thank you for your service.
Welcome back to Veterans Health Watch. We're now joined by Ellen Asbury, the Director of Infection Control for the VA Maryland healthcare system, for discussion about influenza and how to prevent it. Ellen, thank you for joining us today.
It's great to be here.
So why don't you get us started? What is influenza?
Influenza is a respiratory illness, airborne, that basically makes you feel like you've been hit by a Mack truck. It is a disease that puts you at risk for bronchitis, pneumonia, hospitalization, and unfortunately some people actually do die from the flu.
Ellen, why is the flu so contagious?
Chris, that's a really good question. Unfortunately, people can be exposed to the flu and not know that they're even sick. So there's a good 3 days that they're exposing all of their friends and family to the flu virus. And it's a respiratory disease, so it's airborne, and you can't see it. It lands on things that we touch, and if we haven't washed our hands properly, we're spreading it to one another.
And Ellen, are there populations who are more at risk of getting the flu?
Absolutely. Anybody who's under the age of 5, people that are over the age of 50, and an awful lot of our veteran population that we would consider compromised, people that have respiratory illnesses such as asthma and COPD, cardiovascular disease, diabetes, a number of items that make you at risk. Not to mention the fact that if you actually are dealing and taking care of elderly people or people in those populations, you should get a flu vaccine.
Ellen, I hear some people say, well, I got the flu shot last year. Why is it important for me to get one this year? Why should a veteran and their family get a flu shot every year? 2
reasons. One, as the year progresses, our immunity to those flus that were in the vaccine diminishes over time. The other thing too is that there's always new flu strains that come through the world, and every year they take a look and see what are the most prominent strains that are come through, and that's what they put in the vaccine. So what you got in last year may not be what's in the shot this year.
Ellen, in addition to getting a flu shot, are there other things we can do to help prevent from getting the flu?
Absolutely. Getting your flu shot is the easiest thing that you can do. But washing your hands, making sure that we cover our coughs and sneezes, what we call respiratory etiquette, as well as staying at home if you're sick. Don't spread the germs around. It's not worth coming into work.
And if someone does get the flu this year, what should they do to treat the symptoms?
Well, again, staying at home, staying in bed, and good fluids, but contact your primary care physician, because an awful lot of the times you can actually have an antiviral put on board that actually diminishes your exacerbations, such as pneumonia and bronchitis.
So Ellen, for veterans who are enrolled with the VA Maryland healthcare system, how can they get a flu shot?
You can call your primary care physician and arrange a time to come in and get your vaccination. But we also have numerous flu clinics throughout the VA. And those are open at various times. You just have to come in and they'll take care of you.
Mm-hmm. So if a veteran has a question about the flu vaccine or other ways to prevent influenza, who should they call?
So we do have a flu hotline, so that has some general information and you can leave a message on it, or you can call your primary care physician.
And Ellen, I know you don't have a crystal ball, but what is it looking like so far this flu season?
Well, it actually started earlier this year than it had in previous years, so it's got a good 2-week head start on us. Flu seasons change from year to year, and a lot of it's dependent on how many people actually get the flu vaccine, how many people take care of their hygiene as they should, as well as whether or not the strains involved in the flu season are actually covered in the flu vaccine.
And I hear some people say that, oh, I got the stomach flu. Is that the same thing that we're talking about, or are these two different diseases?
They're two different things. So we're talking about a respiratory virus when we talk about influenza and getting the flu shot. GI illnesses are caused by a number of different items, and those aren't covered. So no, we're not talking about that.
So before we exit, are there any things you would like to leave our viewing audience with today about preventing the flu?
Again, the easiest thing you can do is go and get your vaccine done as soon as possible. It is flu season. There's no reason to wait. If you're a veteran, you can get it free. If you work for the VA, you can get it free. Wash your hands, cover those sneezes, and stay at home when you're sick.
Thank you. That's wonderful. I think our viewing audience has learned a lot about what to do this flu season to help prevent from getting it.
Thanks, David.
Well, that wraps up another edition of Veterans Health Watch. Thank you for joining us today. If you'd like to make suggestions for future topics or even have questions about today's show, please call us at 1-800-463-6295, extension 7101. You can also visit us online at www.maryland.va.gov or visit us on Facebook and Twitter.
If you are a veteran or know a veteran who's interested in enrolling for health care, please call 1-800-463-6295, extension 7324. Come in person or visit us online. Thank you for joining us today, and we look forward to seeing you again.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.
The VA Maryland healthcare system is a great system.
It's not your grandfather's VA.
We are a progressive and dynamic healthcare system.
And it's our mission to provide the highest quality healthcare to our veteran heroes.
Great programs, great technology, great staff.
And it's just touching to see how everybody just come together as one.
We do what we can to see that they get the best service.
It's a family. Nobody takes better care of you than family.